It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that are really changing people's lives. We have a lot of great doctors on our show today, and up first we're going to see how breast augmentation helped change Karen's life with plastic surgeon Dr. David Altamira.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back in home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A. And after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
Drink green tea. It's packed with heart-boosting and cancer-stopping polyphenols that black tea doesn't offer. Green tea also delivers a boost of alertness, but from a smaller dose of caffeine than black tea.
I was quite tired, and I travel considerably, and at that time I would go through an airport and I'd have to stop and rest, and so I realized that I needed to check in with a doctor and see what was going on.
So Mr. Richardson has cardiomyopathy, ischemic cardiomyopathy from coronary artery disease, multiple blockages that really weakened his heart over time, and that's how I found him many, many years ago, about 15 years ago.
Pretty common that you neglect yourself. You think nothing's ever going to be wrong, but I found out I had high blood pressure and I was border diabetic, and did a CAT scan, and during that time they found out that I had an irregular heartbeat. So at that time I was told I needed to go to the emergency room, and next thing I knew, I was having a quadruple bypass.
We were able to intervene on his cardiovascular disease, coronaries, fixed those. But what happened was the heart was so weak, so he ended up needing a device, which is different than a pacemaker. It's the shock box. A defibrillator is put in under the skin, and again, like the pacemaker, the wires will go to the heart. But then this box is able to protect the patient, shock them, if the heart stops, or if the heart goes into ventricular fibrillation or ventricular tachycardia.
Well, I'm able to carry on my daily work duties, and I can travel, and I'm not so sure if I hadn't had this great care that I would have been able to do that at my age. I'm going on 71 and still working every day, so I give Dr. Varughese lots of credit that she's helped me sustain a good life.
He's been able to function normally, and it has actually improved the function of his heart. He can walk around, he's not short of breath, he can take care of his thousands of employees and customers, and what a blessing that's been for him.
If you have a question for any of the amazing physicians you've seen on our show today, just head to our website. It's bestdocsnetwork.com. Go to the doctor's profile page and click on the Ask a Question tab. And you may have a question for our next doctor. We're going to hear about postnasal drip and deviated septums with ear, nose, and throat specialist, Dr. C.T. Nguyen.
My biggest problem was that I got several allergies. I couldn't breathe. I was snoring at night. I was sneezing a lot during the mornings when I woke up. And I was always having nose discharge.
Irma is a young professional who came to see me because she can't breathe through her nose. She has this chronic problem that never went away. She consulted many doctors, and all she got was a prescription of antibiotics, and that's it.
Since I was a child, I had that problem. I've been treated for allergies. I get better for specific periods of time, but I travel a lot. I travel internationally, so it's different pollens and different trees, or the landscape is totally different, so I couldn't find a solution.
Doctors has treated Emma's problem with multiple courses of antibiotics. I see this condition all the time. Patient has been treated with antibiotics, antibiotics, antibiotics. The problem is that antibiotics may improve your symptoms, but it will mask the cause of the problem.
He explains you everything. He shows you, like with endoscopy, I could see my nose inside. I saw where parts were infected, and he was telling me what he can do for me and what would be the results.
Decide upon a plan of treatment consisting of endoscopic sinus surgery assisted with GPS-like technology to target her diseased sinus.
He really accommodated the surgery to my lifestyle. He already told me, you are going to follow your allergy treatments with me, and now everything is working perfectly for me.
We are at the forefront of medical technology to improve our patient outcome. We want our patient to recuperate faster and feel better.
I'm breathing, I feel healthier, I feel younger. I highly recommend the sinus surgery for everybody that has chronic cold infections.
Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
You hear a lot about probiotics nowadays. A lot of people take probiotics. In some cases that's good, in some cases it's not going to help much. Probiotics are microorganisms that people take, and it gets in their intestines and populates their colon with the good kind of bacteria, like the lactobacillus, for example. There are lots of different kinds of probiotics, and in general, people that are healthy and are having no gastrointestinal symptoms don't need them. However, if you've had a lot of diarrhea, or let's say you have a lot of gas, either from the upper end or the lower end, or let's say you just have a lot of bloating and feel bad, probiotics may help you. Don't get the expensive brand name stuff over the counter, get the cheap stuff. Yogurt may work sometimes, but generally the probiotics that are over the counter are more concentrated than the yogurt. And it does repopulate your colon with the right bacteria and can help you with everything from gaseousness to diarrhea. That's a crowd pleaser. Go ahead and take it, it might help you.
I've always been slim, or on the slim side. Always had a little pooch for a tummy, but it wasn't anything that I couldn't, cover up in clothing or suck it in. And then, I wake up one morning and just went, what's this? And it didn't matter how much I exercised, I've always ate well. I could not get that stomach to go down, and it happened in the upper section also.
Our patient for Cool Sculpting came in for abdomen treatment, very concerned about her stomach. She had areas that she couldn't get off despite diet and exercise.
So I just went, clothes aren't fitting, I can't go on like this. And so I started researching, and I decided on the Cool Sculpting simply because it's non-invasive. I didn't want to go under the knife.
So the Cool Sculpting procedure will take about an hour. It is non-invasive. When the procedure is done, you can go about your daily activities. You'll see the most results at about 2 months. So the whole concept is you can take the skin and the soft tissues to a lower temperature, freeze the fat, which actually kills the fat, but it leaves the surrounding tissues intact.
Of course, you get the list of what could happen, and I didn't have any cramping. I did have just ever so slight bruising, not purples and blues, just a little red and a little tender, and that was it.
It is permanent. The affected area will kill about 25% of the fat cells. The recommendation these days is to do 2 treatments within a month so that we can get about 50% reduction of the area. Some patients just need 1 and they're happy with it, but a lot of patients can get 2 and get better results.
I had it a year ago last January, yes, and I'm just really thrilled that I had it done. My clothes fit again. I could not wear this skirt a year ago, and it was cheaper to have it done than going out and buying a new wardrobe. Simple as that. I would say I'm a victim of fashion, and I like feeling good in my clothes. I like to look good. And so, yeah, there's a little vanity in there. And the hubby kind of likes it too.
For more information and to check out hundreds of videos, head to our website. It's bestdocsnetwork.com. And up next, we're going to see how David had a smile makeover with oral surgeon Dr. Paul Metz.
My teeth needed to all be extracted. They were crumbling, they were breaking, I couldn't chew my food.
He's a professional, an accountant, and he's certainly concerned about finances and how to structure his budget. And he was a guy that his lower teeth were worse off than the uppers. And so that was an area that he decided to focus on.
I guess this started in 2009, and this really happened in 2 settings. So that in 2009, we did the lower, and in 2011, we did the upper. The bottom is all done, and I'm in the midst of having the prosthesis on the top done.
And also with David, his concern regarding his budget, we were able to do this without grafting. Previously, in the upper jaw, because of the maxillary sinuses, we would have to graft those areas. In majority of cases that we were placing a full jaw worth of implants. But with the advent of cone beam CT, we're able to look at individuals from a 3-dimensional standpoint radiographically ahead of time so as to know where the bone is so that we can position implants within that bone and avoid the need for sinus grafting and then subsequently lower his overall costs significantly as well as increase the predictability.
No longer do I have to make sure that everything is in place where it's supposed to be in place. I have a new chance at a brand new set of teeth, and they don't hurt.
it's just satisfying to see them come back smiling, see them walking down the hallway, standing upright with their chin up, smiling, and being much more confident. So from a psychological standpoint, outside of the health benefits that you see, the mental health benefits are significant.
I'm a CPA. I meet with clients and high net worth clients. Appearance is important to me. It's certainly not of the utmost importance, but it's important to me. And I don't want to be embarrassed by a crumbling smile line. It's a wonderful, wonderful solution.
University General Hospital is a hospital like no other, with state-of-the-art medical treatments in an inviting environment that pampers patients and families and encourages relaxation and healing.
I decided to come see Dr. Marvin because I struggled with weight my entire life.
Well, Amanda's a fairly young patient. She's in her mid-20s when she had the surgery. She did meet the National Institute of Health criteria for weight loss, which means that her body mass index was 41. She was morbidly obese. She wasn't manifesting too many other medical problems related to her weight yet, but again, she's on the young side, so she had some lower extremity swelling and those kind of things. There's tip-offs that things aren't quite right.
I was very uncomfortable. I was like one of the only heavy people in my group of friends. My husband is very lean and active, so it had a lot to do with our lifestyle, and I wasn't able to go to the pool, and I didn't want to wear sleeveless shirts, or when my friends went out to the club, I didn't want to go to the club, and so it had a lot to do with my age, and I wasn't able to live life.
Amanda's lost from 240 pounds down to 128.5 pounds, and that's a very significant weight loss. That's great. That's a very good outcome for a gastric sleeve.
The recovery for me was pretty simple. I took 2 weeks off of work. I could have gone back within 5 to 7 days. I get emotional when it changed my life. Just wearing sleeveless shirts, being able to dress like everybody else, being able to spend time with my husband and go to the pool and just be active. A lot of people started to talk to me again because I wasn't friendly whenever I was heavier. I was angry, I didn't want to do anything, I was like a hermit. So my responses, they want to know how I did it, and I'm very open about how I did it. I was like, I had the surgery. I couldn't do it myself. I could not do it without the surgery. Could not have done it.
My patients, since obesity is a systemic disease, when we cure it for them, they get better on so many fronts. It's nice to see how they're doing afterwards. They really are changed people.
For more information on some of the best doctors in the Houston area and to watch other life-changing stories, log on to bestdocsnetwork.com. Deep breathing can help you relax, but that dose of oxygen will also make you feel happier and more alert. Practice this by taking deep breaths, sucking air in through your nose until your lungs are full. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you, which could be our next doctor. And we're going to hear about treating neuromas and how Bernard's life was changed by podiatrist Dr. Gabriel Maislos.
First started having some pain in my right foot after an incident stepping out of a pool, and I thought it was just a simple bone bruise, but then I had some numbness, and so I went to see some podiatrists, and initially they felt it was related to my diabetes.
When he came into my office, he complained of shooting pain in his toes. So after doing an examination, an ultrasound exam, and then he exhibited signs of a neuroma. A neuroma is essentially a nerve that is compressed by the sides of the metatarsal. So the nerve courses in between, and with a neuroma, it becomes inflamed. And after a while, it develops like a fibrous sheath, and it's no longer just inflamed, it's enlarged.
In terms of quality of life, I'm a big golfer, and it was really made every day, and certainly the enjoyment of playing golf a lot less enjoyable because of the problem.
So Mr. Weber came in with the symptoms of a neuroma, and I believe I treated him a couple times with sclerosing injections. Orthotics were given to him, and as well as instructions on stretching and taking an anti-inflammatory. And he just didn't get better. So at that point, he elected to have surgery.
Well, I think certainly in my case as a diabetic, and given that the symptoms are so similar, that this could happen to other people. I wasn't even aware of what a neuroma was, and being a diabetic, so I think just awareness is a key to understanding that numbness doesn't always mean diabetic neuropathy, and it could be an actual injury to your foot, and you should see a podiatrist.
The procedure, it's very rewarding because patients like it, and there's minimal pain postoperatively. If anything, there's some temporary numbness, and then after a while, patients regain sensation.
My experience with Dr. Maislos, what I like about him is he is very circumspect. So he doesn't assume anything. Let's go through all the steps. He's really interested in finding a solution. Very pleased with the care that the doctor has given me.
Get at least 7 hours of sleep a night. It will help you live longer, lower your stress, sharpen your memory, and reduce cravings for fattening foods.
I came to Dr. Lewis because I always wanted to have really white teeth. And my teeth were straight. I never had to wear braces, didn't have any of those issues, but I had extreme sensitivity. So I could not use any of the whitening strips or just the gels that anyone could. My gums were receding probably because I am one of those brushers that brush the wrong way, didn't do the circular motion.
She really wanted veneers. She had just gone through a lot of personal stuff, and she wanted to make a change in her life, but she really did not want her teeth touched. She did not want anything reduced on her teeth or anything prepared.
So he sort of walked me through the process, and I found out that what he could do was I didn't have to have any, didn't have to have my teeth all filed down. They just sort of buffed them, and he just recreated sort of my smile. It's really strange because it didn't change a whole lot, but it did change a whole lot.
So we did the set on her, and they turned out beautiful. I've done thousands of them, and people are very happy with them. And what we found out is, in most cases, they're stronger, even though they're very thin, they're stronger than regular veneers because the strength isn't derived totally from the thickness of porcelain. I mean, you have to have a certain thickness, but it's derived from the bond to the tooth. And we found that when we bond to the enamel, which is the natural outer layer of the tooth, that we get a much stronger, much harder veneer.
Just the craftsmanship was amazing. I mean, it was like going to a Da Vinci or somebody because it was such tiny details, but it really changed my smile.
So in actuality, not only are they, less destructive to the tooth, or you don't have to take anything off the tooth, but they're also stronger, and so they look great.
It was painless. Came back, put them on, was getting my hands massaged during the whole process, and I walked out and I had a perfect smile that looked natural. I enjoy smiling, and I love having people say, "Oh, you have the prettiest smile."
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and you know, the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing that's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
My legs were very, very tired. I couldn't sleep, toss and turn, couldn't get comfortable. They would just hurt, and all night for years.
Restless legs is best described as a very strong sensation or urge to move your legs. It becomes disabling because it creates an anxious sensation. It's hard to explain. You're not sure what's causing it. You just have this overwhelming urge to move your legs. It almost always occurs at night, and because of that, it creates severe insomnia and severe anxiety.
I had varicose veins. I knew I could see them on the outside. I didn't know about the veins on the inside that were not allowing the blood flow to go past my knees. That would just go up so far and then just go back down to my feet.
We mapped her veins very carefully using ultrasound. We again isolated all the bad veins, the ones that were too large and the blood was running backwards because the valves had failed. And then we selectively ablated those using radio frequency under ultrasound guidance.
No pain, just a little stinging when they first go in with it, but really not much, even though they say, well, it's not gonna hurt, it's not gonna hurt, but it really didn't. The last treatment I had, I didn't feel a thing.
And we do that without any incisions or anesthesia. The patients can walk in, sit down, have the procedures done, stand up, walk out, get in their car, and drive themselves home.
I would say don't worry about it, just do it. Just get it done because you need to have it taken care of. Sleeping now, I rest comfortably, and it turned out good.
In the past, we used surgical procedures. Problems with that: one, it required general anesthetic. Two, it required big cuts with potential side effects like infection, damage to nerves, arteries, muscle, and they weren't selective. We were almost randomly choosing veins to treat, and they weren't always the only or maybe even the correct veins to treat. Now we selectively treat only the veins that are running backwards, so it works much better.
Those were some really life-changing stories. And that's going to wrap up today's edition of Best Docs Network, the show that's featuring some of the best doctors in the Houston area that really do change people's lives. If you have a question or comment or a life-changing story of your own, we would love to hear from you. Send us an email at info@bestdocsnetwork.com. Thank you again for watching, and we'll see you next week.